It's the Mark Mason Show on 1190 KEX.
There have been a lot of medical advances in just the last few years that have amazed people. But there's one that really stands out to me as maybe being one of the coolest. And that is the fact that you can email your doctor if you need to. This is stuff that we could never even think of maybe 5-10 years ago. And then get a response from your doctor, ask a question, refill prescriptions online, things like that through your doctor's office. And I sometimes feel guilty when I write my doctor or doctors, and you know my medical past, everybody. I mean, I'm constantly worried, and every little thing I get online, and I go to the web page, the MyChart web page, and I ask the doctor a question, and every time somebody from the office gets back to me. Well, I wonder too, gee, this has got to cost them time and money. It turns out it does. And reading an article in the New York Times, doctors are beginning to think about charging people for this type of telemedicine. Joining us is Paul Seegert. Paul is a managing partner with PCS Advisors, a health benefits consulting firm across America. And Paul, you've picked up on this too. And first, let me welcome you to the Mark Mason Show. Am I right? This is kind of a new paradigm in medical care, isn't it?
It is. We're in a really fast-changing world of seeking care. And in recent years, especially with the pandemic, it pushed a lot of us toward virtual care and telemedicine, which had been around a long time, but we relaxed some rules and cross-state line type rules and different restrictions that had been in place, and it picked up a lot of steam. And they've created a new billing rule that allows providers to charge for e-visits, which would be when you email with your doctor.
Now we got a name for it, e-visits. I always, when I did this, I kind of, in my mind, I said it's a trade-off because we do virtual visits, right? You could do it from your home and just talk to the doctor. I never really appreciated that. It was nice to not have to get up and go all the way downtown to the doctor's office, but the fact that they listen to your heart and run a couple of other tests, you don't get that when you're sitting at home. Right. But emailing the doctor, man, you could. I imagine I try and keep my questions brief and to the point, but I imagine there's some people out there who write an essay on something and send it to the doctor. Yeah, and I'm sure the physician's assistants probably read it, but the doctor's got to respond and ultimately be responsible for that, don't they?
They do. And so what we've seen is you can still get a lot of the quick emails. Maybe you just need a prescription refilled or something like that. You can get those and you won't necessarily be charged for that. But what the e-visit rules are or kind of standards is that if they spend more than 5 minutes in the course of building that response, then they're going to bill it as an e-visit. Ooh. And their time is, their time is their product that they're selling. And I don't think anybody's against them getting compensated fairly for that. I think we'll just want to keep an eye on it and see how much are health plans being charged for this service.
All right, let's get to the nitty-gritty then. How much are they billing your insurance company or billing you for that?
Right. We've seen it as low as $3, as high as $100.
$100?
And so it varies quite a bit.
$100? Now, this is probably something insurance pays, I imagine. So have they worked out these numbers with insurance companies?
Yeah, so that's the issue right there. And I think it kind of puts a spotlight on one of the challenges that we have in our payment model, which is that if insurance is going to pay and you're not paying immediately yourself, not that you wouldn't necessarily, depends on your plan design. People that have really high deductible plans might be on the hook for the entire cost of the visit. But a lot of times when insurance is going to pay for something, then whoever is selling that product or service, we watch the price go up. And then I think, well, insurance is going to handle it. But that does end up becoming a part of your premium and your increases in premium in future years. So we still want it to be a reasonable charge. And I think lots of folks out there would maybe rightly question $100.
Yeah. The questions I have are usually questions I had formulated in my mind. I wanted to ask the doctor in the office. And then invariably, there's a certain amount of intimidation that goes on. You get brain freeze and you walk out of there. Oh, I forgot to ask the doctor about this. And so, I go home and I type up an email and ask a follow-up question. I haven't been dinged yet, but I feel bad about that. I mean, I'm sure the last thing the doctors want to do is sit in front of a computer for the last couple of hours every day.
That is one of the biggest complaints is the increase in time with administrative work. But I think while this is electronic, it's probably more enjoyable to them than a lot of the paperwork we bury them in with our system overall. Yeah. Well,
OHSU, by the way, is one of those hospitals that said they have charged for fees for e-visits. So I can't speak for some of the other chains here in the Portland area, but at least OHSU is on record. I don't blame them. So PCS Advisors, how a health benefits consulting firm, are you on the patient side or on the caregiver side?
Well, we work for employers mostly.
Okay.
In fact, we have some in your area. I'm based in Nashville now. I used to be on the road 45 weeks a year flying around the country and have customers everywhere. But now I do a lot of my work virtually. But at some point, it's still nice to go meet people. And we have some new clients right there in your area that I was out visiting in the last month or so. And we show them how to kind of eliminate waste in the cost of transactions in their health plan and lower the cost of their health care for their employees.
So let's talk about how patients know that they'll be charged for emailing a doctor. Is there anything that is a clue that they may be hit up for some money if they don't have the right kind of insurance, they'll be responsible for it?
We're still watching this thing evolve. You have a lot of pilot programs out there. Some of the programs are saying, UCSF as an example, that you won't get charged without knowing in advance that it's a billable event. But I'm sure there'll be some folks that are surprised along the way, and then this too will become kind of a normal part of how we all access healthcare in the years to come.
Wow. Well, it is turning into a virtual world here pretty soon. Paul, you and I are going to talk again somewhere down the road. We're going to be talking to AI doctors. How much you want to bet?
I believe that's probably true.
Paul Seegert, the managing partner at PCS Advisors, a health benefits consulting firm. When you email your doctor, just realize, you know what? I guess this is the old adage, time is money, right?
That's it.
All right. Paul,
5 minutes is the mark.
Yeah, pleasure to meet you. And so I hope we talk again, Paul. Thanks for joining us here on the Mark Mason Show in Portland, Oregon.